This topic on glossopharyngeal nerve. Now we are going to see the origin, course and branches of glossopharyngeal nerve and what will happen if the nerve is lesion, the clinical features. You see, when we are talking about the glossopharyngeal nerve, that is nerve number 9, first of all, you should know that it is involved in controlling the parotid salivary gland. And we have to discuss the parotid pathway separately, but briefly I'll just tell you that ninth nerve is going to send what is called as a tympanic branch. The tympanic branch of ninth nerve will go to the middle ear cavity, contributing to tympanic plexus, and then from the tympanic plexus one nerve will come lesser petrosal nerve. This is all preganglionic fibers, and these preganglionic fibers will then go and synapse in the aortic ganglion. The postganglionic fibers, as we know, is carried by the topographic nerve trigeminal and control the parotid gland, but we have to draw this diagram separately to discuss the details. The other thing it is doing is supplying stylopharyngeus muscle. There is only one muscle developing in the third pharyngeal arch, and that is stylopharyngeus, and it is supplied by glossopharyngeal nerve. Now this ninth nerve, it is also carrying some information from the carotid body and carotid sinus like chemoreception and blood pressure sensation towards the brain. So it is sensory to carotid body and carotid sinus. It is sensory to the tonsillar area also. In fact, what happens is if there is a pathology in the tonsil, say we have done tonsillectomy or there is some tonsillar abscess, pain is referred to the ear. That is a referred pain. Understand that similarly, as the glossopharyngeal nerve was supplying posterior 1/3 of the tongue, if you remember, carrying the general sensation, taste sensation from the posterior 1/3 of tongue developmentally, any tumor on the posterior 1/3 of tongue, the pain can be felt, referred otalgia. So it is called referred otalgia towards the middle ear cavity. Problem is on the tongue, tonsil, but the pain is felt in the ear because of, the axons of glossopharyngeal nerve going to various places can be felt interchangeably at various places. So these are some of the things which we are supposed to focus upon. But the parotid pathway is more important. So let us look at the details of parotid pathway then. See, if you remember, we have discussed inferior salivatory nucleus in the lower pons sending preganglionic fiber by the glossopharyngeal nerve. It is called as tympanic branch of the glossopharyngeal nerve. In fact, it has one more name. It is called as Jacobson's nerve. It comes as a question. So Jacobson's nerve is the tympanic branch of the glossopharyngeal to carry preganglionic fiber to the tympanic plexus in the middle ear cavity, then continue as the lesser petrosal nerve, and then synapse in the aortic ganglion, which will then send postganglionic fiber by branches of the trigeminal. In this case, it is auriculotemporal nerve. There we'll talk about Fraze syndrome as well. Let's draw the diagram. See, if earlier we have seen there was this inferior salivatory nucleus, and that inferior salivatory nucleus was for the ninth nerve. The ninth nerve, which is having some secretomotor fibers for parotid gland, the inferior salivatory nucleus will send fibers, and those fibers will be exiting at the pontomedullary junction. Ninth nerve also, actually it is not pontomedullary, it is actually in the medulla and behind the olive, in fact, though it is near the pontomedullary junction, but it is behind the olive in the medulla. You remember in the medulla there was one anterior pyramid, and there was behind that there was some olive. So first you have the pyramid anteriorly on the medulla, then you have the olive. Behind the olive you have the nerve number 9 coming. So nerve number 9 comes from the medulla oblongata, yes, and behind the olive, yes. Then what is it doing? It was going to do whatever jobs it is supposed to do. What is it supposed to do? Like it is supplying the carotid body and carotid sinus. Okay, what else it is doing? It is supplying the tonsillar area, and it is supplying posterior 1/3 of tongue, and it is supplying some muscle developing in the third pharyngeal arch. Who is that? That is stylopharyngeus muscle. So these are the jobs which the glossopharyngeal nerve is supposed to do, but it has one more job. What is that? It is giving a tympanic branch into the tympanic plexus, which is in the middle ear cavity. Remember, middle ear cavity is supplied by tympanic plexus, and the major supply is by the ninth nerve, which is called tympanic branch of the glossopharyngeal nerve. Now, if you say it is a tympanic branch of the glossopharyngeal nerve, the major supply to middle ear cavity, what else does it do? Actually, from tympanic plexus, one nerve will continue. What is that name? Lesser petrosal nerve. And what is the lesser petrosal nerve doing? If you remember, lesser petrosal nerve has to pass the, remember, male structure passing foramen ovale. So it is passing the foramen ovale, the male structure passing foramen ovale. You are telling that from the tympanic plexus, the preganglionic fiber are now carried by lesser petrosal nerve passing the foramen ovale to reach the aortic ganglion. And when it is reaching the aortic ganglion, what it will do? Actually, aortic ganglion, the postganglionic fibers will be carried by auriculotemporal nerve. It is auriculotemporal nerve, which is a branch of the mandibular nerve, which is a branch of the trigeminal nerve, carrying the topographic fiber, postganglionic fiber. So aortic ganglion is sending the postganglionic fiber by the auriculotemporal nerve, which is actually branch of mandibular nerve, trigeminal, and it is the topographic nerve. Then what is the glossopharyngeal nerve here? It is functional nerve. Glossopharyngeal is functional nerve. Trigeminal is topographic. Where is the fibers going? Of course, to the parotid salivary gland. You have to supply parotid salivary gland. Now, I was operating and I have removed the parotid gland, and of course there is injury to the auriculotemporal nerve. So it is regenerating. Where? There is no parotid gland. Yeah, but it is regenerating. Regenerating where? It will regenerate into some sweat gland. Which sweat gland? Around the ear, wherever the parotid was. So wherever the parotid was around the ear, it will innervate some sweat gland? Yes. So what is the problem? Problem is, whenever this man is having food, there is sweating in the skin. Why sweating in the skin? You know, when you are having food, yes, this pathway will be activated, yes, but the parotid is not there. So sweat will be there. Oh, gustatory sweating. Yes, it is called as gustatory sweating. And it is also called as the Fraze syndrome, or it is called as the auriculotemporal nerve syndrome. So it is auriculotemporal nerve syndrome after removing the parotid gland. Yes, actually, there was a removal of parotid gland. You have damaged the auriculotemporal nerve. It was regenerating, but there is no parotid gland to regenerate into. So it will regenerate into some sweat gland in the territory, maybe around the ear, in front of ear. And whenever this man is having food, salivary fibers are activated. But salivary fibers cannot give you saliva now. It is giving sweat. So sweat comes with saliva. Maybe you have removed this parotid. That parotid was working. Some saliva still coming. So this parotid gives saliva. Yes. And that parotid is not there. No. So what comes along with saliva? Along with saliva, sweat is coming. This is called as gustatory sweating or Fraze syndrome or auriculotemporal nerve syndrome. Like the crocodile tear syndrome. Yeah, there it was tears. Here it is sweat. So it was injury of auriculotemporal nerve. Yeah, that's why auriculotemporal nerve syndrome.